Good morning, Hank. Do you think you could tell me a little bit more about your editorial and the latest version of Developmental Medicine and Child Neurology?
Well, Ben, I think you and I have both noticed that many of our patients are getting their information from the internet, and I was just raising some issues about that, both in terms of the use of advertising and also promoting procedures and techniques that may not have any scientific validity.
Do you think just from an ethical or practical perspective that advertising on social media is an acceptable way to promote surgical interventions?
It's an ethical challenge for all of us to decide whether you should advertise. However, if you have a great new procedure or you're seeing good results, I think this is the best way to share those results.
Do you have any suggestions as to, how to at least make it easier for parents to navigate through social media?
Not everything's bad on social media. There's really great things where families are sharing their experiences and their concerns and their worries, and I don't think we should diminish that at all. But I think we should, maybe have alternatives throughout either our academy, American Academy of Orthopedic Surgery, or the European Academy, or AACPDM. All these things where we can put out the best evidence.
How do you give advice to your parents as they're trying to navigate a surgical environment for children with CP?
Well, I ask them to look at really good websites such as yours at Boston Children's. There's great things at like DuPont Children's Hospital and at Gillette Children's Hospital. Just well-known, well-regulated, well-done sites so they can understand that. But families are going to go where they're going to go, and you certainly can't push them in one direction or another. One of my former patients has gone through this procedure. Could they talk to them? And that's a little bit awkward, but maybe it's easier to do that in a social media.
Do you have any suggestions or tools, apart from looking at other websites, for parents to just kind of assess the validity or claims that they read about in social media? Because some of the claims are pretty impressive, and then you start to look at those claims, and even myself, when I was looking at some of these pages, was almost starting to get convinced maybe I should try some of these interventions because it looks like the results are so good.
That's not just true of surgical interventions. It's true of politics. It's true of everything we do in life. And so at some point you need to find a practitioner whom you trust and say, I just read this on the internet. I'm on a couple of blogs and I'm seeing all these things. And what do you think about this? And hopefully those of us in the field are keeping abreast of all these different alternative treatments. Now, alternative doesn't always mean bad, but it just means that they don't have any evidence behind them. But I think we have to go to all of these new treatments with some skepticism and maybe share that with our families.
I think that your editorial really shed light on a problem that has slowly become a really present issue within our community. And I really appreciate you giving me the time to talk today and answer questions because I think it was very enlightening. Have a nice day.
Well, thanks, Ben. It was great talking to you this morning.